So my topic for the diabetic teaching project is the signs and symptoms of hyperglycemia. So first, some things that we need to assess before we can teach our patient. The first one is the principal learning domain. So are they a cognitive, a psychomotor, an affective? How do they learn best? So cognitive involves the memorization and recall of information. So to do this, you would provide the education session, repeat the information, and then also ask the patient questions. So this helps just repeat the information over and over again. The psychomotor aspect would be the use of motor skills and physical movement. So the patient will get hands-on, they'll demonstrate the skill and just use their hands. The affective style, it takes into account the patient's feelings, values, motivations, and attitudes. This is the patient receiving the information, or they actively participating in the teaching. So then once you determine the learning style, you need to assess their learning needs. Determine, does the patient actually even understand what hyperglycemia is? Does the patient, would they rather learn in English or Spanish? If they are Spanish, you might need to obtain a translator and make sure that it's somebody that is not a family member, and you want to make sure they're a professional. You need to determine if the patient has any specific cultural or religious barriers that might affect the teaching. So like a patient whose cultural beliefs and values are considered, they're going to be more likely to accept the instructions. If you just completely ignore their culture, they're going to be a little less receptive towards you. So you also need to assess their readiness and their ability to learn. So there's a lot of different things that go in with this. So the first thing is, how does the education, experience, or occupation affect or influence the learning process? So depending on what their education, experience, and occupation are, that's going to determine what they're going to understand. So if you have someone with a 7th grade education versus somebody with a college degree, obviously they're going to understand things a different way. You can use different words. You can use different styles of the way you talk. If they have a job, they're going to learn different than if they have no job. It just all plays into what they're going to understand. What adaptations must be made based on a patient's cultural or religious background? So, if they have some beliefs or practices that are going to interfere with treatment, such as, do they refuse to receive blood products? Or can they only be cared for by a certain gender? And then also, again, with the language, you might need to obtain a professional non-family member as a translator, and then you can always use photos, drawings, or videos to support your instructions. What economic factors should be considered? So, does the patient have the ability to afford the medications that are going to be needed? Does the patient have the ability to seek medical treatment if it's needed? Would illness affect the ability to learn? So if a patient is in pain, they're not going to be as receptive to learning because they're in pain. If they're not feeling well, they might not remember what's taught. So it's always best to do a teaching when the patient is not in pain, not fatigued, and not ill. Age group. So how will patients of different ages need to be addressed? So the stage of development and the age are going to affect the different instructional methods and materials used. So if you're teaching an infant, or not an infant, you wouldn't teach them, but if you're teaching a young child, you might use pictures and toys to teach them. Whereas if you're teaching an adult, you wouldn't necessarily need to use toys. Whereas if you're teaching an elderly patient, you might have to use bigger type on your words. Like if you have a pamphlet or something, you might need a bigger type. You might need something if they have hearing loss. Like that all goes into effect. You also, with different ages, you're going to be pacing yourself differently. With young children, you're going to need to go slow, as well as with elderly, because you can't talk too fast. And then the difficulty level of the content. So again, if you have a school-age child, you can't be using medical terms. You can't be using long, big words. You would have to kind of bring it down to their level. Should significant others be included in the teaching sessions? So support from significant others is huge. but ultimately it is up to the patient. So you need to ask them, do you want your husband, your wife in the room with you? There is a huge benefit of having the significant other in the room if the patient later on down the road forgets. The significant other has learned what to do, so they can, reinforce the teaching with the patient. So planning, you need to have an objective for your teaching. So for me, patient is going to be able to identify hyperglycemia. That's my the teaching outline for my topic. What is hyperglycemia? Let me just run a brief overview of that because there's no point in me telling you the signs and symptoms if they don't know what it is. And then what are the signs and symptoms? I'll run through those. And then I'm also going to just briefly mention what to do for hyperglycemia. So let's teach Mrs. Thomas.
Hello, Mrs. Thomas. My name is Sammy. I'm your discharge nurse today. I was hoping to just run through hyperglycemia with you. Is it okay if I do that in English?
Yes, English is fine.
Okay. So hyperglycemia, just to tell you kind of briefly what it is, it's just when your blood sugars get high. And so it can be caused by infection, illness, corticosteroids, if you eat too much food, if you're inactive or have stress or anything like that. And so it's just whenever your blood sugar is high, typically about 180 repeatedly. Do you kind of get that?
Yes, ma'am, I do.
Okay, and so some signs and symptoms of it. You could have frequent urination. You might have an increased thirst or an appetite. Your vision could become blurred, and then you might become fatigued. This could advance on into noticing a fruity smell to your breath. You could have nausea, vomiting, and abdominal pain, and then also like a dry mouth and confusion. So that's just kind of, any of those things are very critical. So if you do notice any of those, you would want to seek medical care right away. And then just, if you are kind of noticing a couple of the early ones, you might just want to increase your fluids and just make sure that you're checking your sugars frequently. Did you have any questions about hyperglycemia?
No, I think I understand it. I don't have any questions.
Okay, so just to remind you, I'm just going to run through those signs and symptoms one more time. So increased thirst, appetite, frequent urination, blurred vision, fatigue, fruity smell to the breath, nausea, vomiting, abdominal pain, dry mouth, and confusion. So if you do ever have any questions about this, just reach out to us or your doctor and we can answer those questions for you. So we're going to go ahead and start working on your discharge paperwork and we'll get you out of here soon. Have a nice day, Miss Thomas.
Thank you.
Hello, Mr. and Mrs. Thomas. It's Sammy again, your discharge nurse. I just wanted to follow up with Mrs. Thomas and make sure that you remembered kind of what we were going over earlier and that you are able to identify hyperglycemia.
Yes, ma'am, my blood sugar would be a little high and I might have increased thirst and appetite. Sometimes nausea and vomiting can also be issues, but most commonly I get a headache.
Perfect. Did you have any questions for me?
No, ma'am, I think that about covers it.
All right, Mr. and Mrs. Thomas. Well, y'all have a good day. Thank y'all so much.
Thank you, you too.